Hello and welcome to Pisgah Health Today. My name is Angela Owen and it's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals, all committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Judith Loam. Judith serves as the Executive Director of the Free Clinics. She's been there for 16 years. She has served for quite a while in nonprofits. We won't give away that number there, Miss Judith. She has a master's in nonprofit administration and is an ordained minister and really does this as a huge ministry and service to the community at large. So welcome, first of all, to Pisgah Health Today, Judith. It is wonderful to have you with us. And why don't you start by just telling our audience a little bit about what is the Free Clinics?
The Free Clinics is a public charity, and we serve Henderson and Polk counties in Western North Carolina. We are largely a volunteer-based organization. We have 25 different programs that serve in 5 kind of large program areas. So we have acute health, we have chronic and specialty disease, we have pharmaceutical support, behavioral health work, and community health. So we are a community of 200 plus volunteers, about 25 staff at this point, upward of 1,000 donors who come together to take care, and 181 health and community partners who come together to take care of the most vulnerable in Western North
Carolina. Wow. So have you seen a change in the last year with the COVID impact? Did you see a change in what you were able to provide out to the community?
We did. It was beginning, it was really trying to figure out how to get Wi-Fi access and those kinds of things available to vulnerable folks who don't have data plans, and with the pivot to telehealth, making sure that our clients could still access help. So that was kind of one of our first waves. Once we did all of that, then working with those vulnerable folks to have them understand how telehealth worked and how they could still get their needs met, and their patient community could still be intact, even though it was different. We've now seen, we of course, with like a lot of nonprofits in Western North Carolina, had a reduction in our volunteer base as people stayed home for health concerns or risks. So we had to kind of learn to do what we do with a whole different style of what our staffing pattern looks like. And then in the last, I would say 8 months or so, we've seen a consistent about 20% increase in clients as newly uninsured, newly unemployed folks find us and need us for care. So it's been a big year, but we never closed our doors. We never stopped serving the community. We just learned how to do things differently.
Right. Well done, and congratulations on getting through the challenges of the year. Of course, who would have thought 5 years ago that we would be talking about the importance of having access to broadband as a huge component of really providing health, right? Health and health care to people. Well, Judith, how specifically has Pisgah Health Foundation been able to come alongside the work that you and your amazing team of volunteers at the Free Clinics are doing?
So our proposal to the Pisgah Health Foundation, our work with them was pre-COVID, but it was really instrumental as we moved into COVID. So we do a model of care that we've been practicing for about 12 years that brings a team of providers together with a group of patients. And it serves as a medical home for some really vulnerable folk. It's a fully integrated team that includes a doctor, a nurse, a behavioral health clinician, a pharmacist, an occupational therapist, and what we call a patient health advocate. And by doing group visits with the team of patients, there's peer-to-peer support as well. So what we found over the course of these 12 years is how profound that moment is where patients can help each other navigate some of the challenges of living in today's world without a lot of economic means and things like that. So we had asked Pisgah to help us pivot our longstanding diabetes program into this group model, and to help us fund that shift. That group had 3 live visits maybe before the pandemic hit. It was a very small number. And but because we were pivoting into this group model, that whole broadband conversation and how to engage telehealth, Pisgah's support was instrumental in us being able to continue to provide really strong, and in some cases stronger than we had been in the past, care to our clients with diabetes who are living with that chronic disease. So it was that the funding, though it was pre-COVID, enabled us to get through that moment of COVID in a new model with some really neat folks who had high need, high risk, and be there, be present for them in ways that I don't think we would have been able to without the support of the Pisgah Health Foundation. So it was one of those very fortuitous moments that there was this new funding to help a new model for our diabetes clients. And then COVID hit, but we were positioned. It felt very grace-filled.
At the table for you. One of the things I often hear the leadership at Pisgah Health Foundation talk about is the importance of social cohesion. And when you speak about that group model, as you called it, you know, that really speaks into that in a beautiful way there. So that's great. So Judith, what else would be important for our audience to know about the free clinics? How can they find out more about you? How can they come alongside and support the work that you and the volunteers are doing?
Well, we always need volunteers. And now with some of the COVID restrictions lifting in different ways, we've had a lot of new folks approach us. So we welcome people to engage with the volunteer effort if they're interested. We also welcome, of course, donations, attendance at events, though those are small right at the moment. We are planning for our 20th anniversary party in October, so there'll be more information about that coming along. Our website is really easy, www.thefreeclinics.org. So we're easy to find. We also are present on Facebook, so if you choose us there, that's the same address, the Free Clinics, whatever it would be for Facebook. Sorry.
No worries.
And our phone number is 828-697-8422. We welcome folks to learn more about us, to engage with us. We are volunteer based, so we need all kinds of volunteers, both providers and clinicians, as well as regular lay folks who help us interview clients and engage clients, serve at the pharmacy counter, all of those kinds of things. So we welcome the participation of the community and to learn more about us.
Lots of ways to get engaged, and it's going to be wonderful to be able to have that 20-year anniversary celebration in October, and hopefully that will be able to be done in person. And just, you know, we all need one another, right? We're all ready to be with one another. Yes. Well, Judith, on behalf of the Board of Directors of Pisgah Health Foundation, let me just say thank you to you, the staff, the volunteers, everyone who is doing so many great things there at the free clinics to serve our communities, particularly the Henderson and Polk County communities. And thank you so much for taking time to join us today on Pisgah Health Today.
Well, thank you. I want to express on behalf of our patients and board and staff and volunteers, our gratitude to Pisgah Health for the support to make that move for our diabetes program and how fortuitous it was in the timing, and for the opportunity today to share more of our story. So thank you.
It is an honor and a privilege on behalf of Pisgah Health Foundation. We also want to say thank you to Wildflower Media for their creative and technical support in bringing these programs to you. And let me encourage you, if you liked this story and would like to support Judith's story here and more, let me ask you to go to pisgahhealthinsiders.org and join the movement. And while you're here watching us on YouTube or Facebook or wherever you may be sure to hit that like, hit that share, and share this story. We want to make sure we're telling the world about the free clinics and so many more things that are wonderfully happening within our community. Until we see you on the next Pisgah Health Today, let me encourage you and thank you for joining us and ask you, stay well and be well.